The one thing about infection prevention and control is it doesn't stop at borders of any kind. So I know
Mhm.
you have those issues too, and you're constantly trying to stop infections from spreading or even starting. And one particular piece of equipment that you have use or that you do use in your hospital are the robots, the UVC robots. Can you explain those a little bit and tell our audience why you chose them and how you use them?
Yeah. So I'm just gonna give a real quick backstory of why we went into getting the UV robots. So when the pandemic first started, the Navajo Nation was actually hit really hard with the COVID-19, and it wiped out a lot of our community members, unfortunately, because we were just not prepared as a nation for that kind of pandemic and for those kinds of pathogens to come through our area. And like I said, it was really hard to reach out to a lot of those people who are in rural areas. So we started to have, we were one of the many health care facilities in our location that stayed open through the entire pandemic. So at no point did we close any of our services down. We constantly had a 24/7 emergency room that ran throughout the entire pandemic. There was some other healthcare facilities around us that had closed for a few days to a few weeks because they just were not ready for that kind of pandemic to happen and to give the treatment and the services that they needed. So with that being said, we saw a really high number of cases of COVID-19 come through um, our emergency department. And we had a lot of staffing that contracted that COVID-19. So on a larger level, our staffing was really affected by it. And so that's when I came on as a supervisor, and I really worked closely with our infection preventionists to find ways of how we could potentially take precautions and have a better approach to everything that was happening around us. So, with that being said, I looked and researched um, other bigger facilities down south. So, I actually got in contact with one of the banner hospitals in Phoenix, Arizona, and I was just talking to them, and I said, I'm concerned, and I have a couple of questions. Um, what do you guys do differently? We kind of collaborated on our protocols and the things that we did with COVID testing, terminal cleanings, um, patient discharge. How were we taking care of those things, and what our protocols were? And so with that, I had asked them, do you guys use any kind of innovative technology? Is there anything that you guys use differently? Because at the time we were using what they call the Clorox 360 machines, which is an electrostatic sprayer. And I said, that's really the only thing that we've been able to bring into our facility to try and help us provide the disinfection that needs to be done. Um, and they were like, "Oh, well, we've been looking into some UV lightings, and we haven't gotten there yet, but we have a company that we're looking into, which is called OmniClean." And I was like, "Oh, okay. Well, you know, if you can send me whatever you have, I'm more than happy to go look into it and see, what they're all about." So from that point, I made contact with one of the representatives from OmniClean, and his name was Dan. And we kicked it off as soon as I made contact with him, and we started talking. I had looked at some other vendors, and he gave me some other vendors who had similar products. And from there, we did our research and what worked best for our facility. And that's what brought us to using the UV lighting. And then I found out that just off the reservation in Gallup, New Mexico. It's very close to where we live. There is the Gallup Indian Medical Center, and they actually were implementing the UV robots from OhmniLabs. And so I asked him, I was like, hey, I'm interested in that same product. Can I come and do an on-site visit? And I want to see, what these robots are capable of doing, if they would be something we would be interested in bringing to our facility as well. So I did that on-site visit, and we got to see the robots in action, and they used them in their surgical unit. And I was like, this is just a great product. I was blown away by the disinfection efficiency that was provided by it, and how simple it was to operate the UV robots, because it's pretty much a step-by-step um, protocol that you follow on the screen, and it was easy. And that's what I liked about the Omni Labs UV robot. And so it struck my attention, and I was like, okay, well, let's look into this. And lo and behold, we have 3 robots that we currently use in our facility.
So the UVC has really helped you. Do you have any like general idea of how you have reduced HAIs in your facility?
Yes. So the UVC robots have definitely helped us. They're an addition um, to our protocols that we currently have in place with our standard cleaning. And so we have various different ways that we're trying to test the efficiency of the UVC robots. One of the ways that we've done that is we have a machine from 3M, um, and it's called the ATP Luminator. That's the adenosine triphosphate. And what we do with that is whenever we run the robots through a room, um, we will take a swab before, and we'll get the reading off of it. So what the ATP machine does is it'll collect all the bacteria from that surface, and you put it into the machine, and it reflects light back with whatever bacteria or pathogen is left on that surface. And it'll give you a real-time number value of what's there. So our goal is to get anything below 1,000. And so we'll take the swab before we run the UVC, after we've done a standard clean, and we take that number, we'll do our UVC run through with our robots, and then we take another swab again. And that's how we're able to compare how efficiently and how much bacteria and pathogens were taken away from that surface. So that's one of the ways that we've really been able to measure the efficiency of the UVC robots. So that data will then be provided back to OhmniLabs so that they can use it to their benefit as well, and make the needed adjustments to increase their software and to increase their product. And so I've definitely been working closely with OhmniLabs to get that kind of data for them.